Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am Fiona, naturopath and co-founder of the Kidney Disease Solution and Kidney Coach. And today I'm joined by the wonderfully talented and beautiful Emily Cahill. If you haven't met Emily before, she's an absolute regular on our YouTube channel. She's part of our Kidney Coach team. She's a registered nurse. She works in a large hospital here in Melbourne in the cardiology ward. Yeah, and she's a registered naturopath, and she's also the only trained kidney coach consultant that works with the Beat Kidney Disease program to help support people through the program and make and tweak programs to make them even more working for you. So if that's a right word, I think I just made something up there. So today, Emily and I wanted to talk about vitamin D and why tracking your vitamin D levels and why making sure your vitamin D stays at a good level is super important during kidney disease. So Em, do you want to, maybe we'll start with a bit of an overview of what vitamin D is, because the word itself saying vitamin D, but it's not a vitamin.
That's
so
right.
Yes, maybe we'll start there and go forth.
Yeah, so vitamin D isn't actually a vitamin at all. It's actually what's called a prohormone. So what that is it's a nutrient that gets converted into a hormone in the body. It's also fat soluble, which means it's stored in our fat cells in the body. And we primarily get it from three different places. So we get a little bit from food, although there's not many foods that have very high amounts of vitamin D. So for most people, they're going to get the majority of their vitamin D from the sun. When our skin's exposed to the sun, the UV rays is converted from cholesterol into vitamin D, which is a whole sort of process that has a number of different steps in the body. And then the third place is from supplements. So people who supplement with vitamin D, that's sort of the third main source.
And so when vitamin D works in the body, and I guess let's talk about sunshine then, because I guess it's people think they get enough through the sunshine. And even I know in Australia, when we're testing patients right in the middle of summer, where you would expect the levels to be super high, and 9 out of 10 times they're not. So what can people think about when they think, well, I'm trying to get my vitamin D from the sun while my level's not high enough? What are the things that affect absorption? And people are actually getting enough just straight through sunshine.
Through sunshine. So there's a few different things that we need to think about. So one is actually where you live in the world. So depending on where you live and how close you are to the equator actually changes the amount of UVB rays in the sun. So people who live further away from the equator, well, for one, they generally get less sunlight in the day. But secondly, there's a reduced amount of actual UVB rays to be converted into vitamin D in the body. And then the other thing to think about is the melanin content of your skin. So the darker someone's skin is, the more of something called melanin that they have in it, and that actually blocks the conversion of UV rays into vitamin D as well. And I guess, one of the big reasons that I think we're seeing lower and lower levels of vitamin D in people, even in summer, is that, we're all taught to slip, slop, slap to when we go out.
Yes,
yeah, I'm just thinking that. I'm like, is anyone actually going to know what that is?
Australian slip, slop, slap.
Yes, so slip, slop, slap is slip on some sunscreen. So wear sunscreen. What's a slop?
Slop on a t-shirt and slap on a hat.
Yes, and slap on a hat. So we're taught to cover up when we go outside in the sun so that we don't get burnt, and so to reduce the risk of skin cancer. So if you're out in the sun and you're wearing a t-shirt or long sleeves or a hat or anything like that, you're actually reducing the amount of your skin that's being exposed to sunlight in the first place, which then means that your body's less able to make vitamin D. And then there are a few, I guess, other categories as well. The older you are, so the older we are, generally the less subcutaneous sort of fat we have under our skin, and the less able, again, that we are to convert cholesterol into vitamin D. So older people are also at higher risk. And for people who are overweight as well, that also reduces the ability of the body to make vitamin D. So, yeah, they're sort of some of the reasons why even, in summer and in sunlight, we may not be able to make enough vitamin D in the body. And then the other part of it that we need to think about is the rest of the process that goes on through the body to change that sunlight into what is the active form of vitamin D. So there's sort of a number of different steps in that, and two of the primary steps, one involves the liver and one involves the kidneys. So anyone who's got liver disease or problems with the liver can have reduced ability to convert the sort of pre-form of vitamin D into its next step. And then anyone who has kidney disease then will have reduced ability to make the pre-vitamin D into what is actually our active form of vitamin D, or what's called calcitriol. So that's, sort of two other, steps in the chain, I guess, that things need to be working effectively. There's different enzymes involved in all of those processes, but particularly that's one of the reasons why people with kidney disease are also, again, at higher risk of being deficient in vitamin D, because their body is less able to do that last step in the process, basically.
Yeah, and I know definitely in our population, our Indian population, that's probably where I see the lowest amounts of vitamin D. And of course, we know Indian genetics, you're more prone to things, especially if you're eating a Western diet, more prone to things like diabetes and other precursors that make you at a higher risk of kidney disease as well. But do you think that because that population is potentially exposed or not, exposed to lower levels of vitamin D, that may contribute to the high levels of kidney disease that we do see in countries like India?
Yeah, potentially. Sort of a bit of a double whammy. Having darker skin means there's less, going into the top of the funnel. And then also potentially liver or kidney problems means then there's less coming out the bottom.
Yeah. Okay, so now that we've covered, vitamin D and a little bit more about it, let's go into all the actions that vitamin D plays in the body, because I think that's really important. So people get a really good understanding, because it's so far-reaching and has so many amazing effects. So let's go over that.
Yeah. So originally, really, vitamin D was just thought of as being necessarily for bone health. And a lot of the initial sort of research on vitamin D was its action in the bone. So people were prescribed it if they had low bone density or had osteoporosis or a risk of osteoporosis. But as more research was being conducted, what they actually found is that most cells in the body actually have vitamin D receptors. And so they then, obviously looked further at that and realised that vitamin D has many more actions than looking after your bones. So what I think a lot of people don't realise is that it's a really strong anti-inflammatory. So it can help to reduce inflammation in the body. Once again, we get back to inflammation. And it's also really important for our immune system. So vitamin D is what is sort of as an immune modulator, which means it has a balancing act on the immune system. So it's important both when people's immune system is maybe under-functioning, so people who get a lot of infections and things like that, it's really important as an anti-cancer agent as well. And then it's also been linked to autoimmune conditions, so conditions where the immune system may be a bit hyperactive, in helping to sort of bring that back into balance. But then, when you sort of keep looking at it, it can help to lower blood pressure. It's needed for insulin sensitivity and the way our body deals with glucose and makes insulin, so really important for people with insulin resistance or diabetes as well. It's, helps with our brain function and uh, and things like reducing the risk of cardiovascular disease. So people with lower vitamin D levels are at higher risk of sort of atherosclerosis or hardening of the arteries. It's important in the way that the heart muscle actually functions. So, you can sort of see that most organs of the body, which is why they all have vitamin D receptors, vitamin D has an action on. So it's far more reaching than just looking after your bones.
Yeah, and I think there's more and more research just coming out about all the amazing things that vitamin D does. One of the things that I always think about vitamin D is it helps regulate our genetic expression, part of which the microbiome does as well. But I always say to my patients, these little HLA genes which code your immune system, basically, and if you don't have enough vitamin D, it's like having Homer Simpson running your immune system versus maybe Elon Musk if you do have enough vitamin D, and that regulating those HLA genes, and that those HLA genes, especially in autoimmune diseases, are meant to tell your body what's friend and what's foe. So if you don't have enough vitamin D there, that whole gene expression changes as well. And what about, I know you touched on the parathyroid, but let's get into the parathyroid and the link to the kidneys and why vitamin D, why we monitor it, why that's a test that, you and I would be asking any patient with kidney disease to go and have to check their vitamin D levels. Why is that?
Yeah, so vitamin D is important for balancing calcium and phosphorus in the body. So it helps with increasing the absorption of calcium from food and also phosphorus as well. And one of the things that we see often in people with kidney disease is this secondary hyperparathyroidism. So our parathyroid hormone as well is involved in that process, and again, balancing calcium and phosphorus. And when we don't have enough vitamin D, one of the things that can happen is our parathyroid hormone gets a bit hyperactive. And again, that's to do with our calcium and phosphorus and having high phosphorus levels. But vitamin D can be used to help reduce our elevated parathyroid hormone as well. But it's important to, when you're testing vitamin D, that you're not just looking at it in isolation, because, as I said, it can also affect and influence calcium levels. It can influence phosphorus levels as well in the blood. So you need to sort of be looking at those things together as well as your parathyroid hormone, because, they're all, again, everything in the body is sort of connected, and those things particularly.
Yeah, they definitely need to work together. So vitamin D deficiency, can it cause kidney disease, or is it more likely something that if people have kidney disease, they're more likely to get vitamin D deficiency, and then that would lead to other potentially diseases or weakened immune systems, etc.? Yeah.
One of the other things that vitamin D does is it helps to control the renin-angiotensin-aldosterone system, which is just a hormonal type system that has a lot of effects on the kidneys. So can vitamin D deficiency cause kidney disease? I'm not sure if, I don't think they've ever picked up an exact cause and effect relationship, but it can affect the functioning of the kidneys. So it can affect that renin-angiotensin system. It can increase the risk of having protein loss in the urine. We know that if we're getting protein filtered through our kidneys, then that can in itself cause damage, which can follow on, obviously, to kidney disease. So I guess, in that way it can contribute. And then because, again, it's involved in blood pressure regulation and diabetes or insulin resistance, all of those things that we know can certainly cause kidney disease. Sort of a bit of a, I guess, multifactorial kind of relationship that can go on if you do have low vitamin D levels, that over time, having higher blood pressure or having diabetes and having protein in your urine, all of that, yes, will go on to cause kidney disease.
So if someone has been diagnosed with, say, stage 3 or 5 chronic kidney disease, and they go and have a test and their vitamin D comes back as low, I know what some of the nephrologists and specialists are saying is to avoid vitamin D is definitely some of the advice I've heard my patients given, because they're worried about the increase in calcium and then the calcium phosphorus ratio that vitamin D so governs. So what is your advice to people? What do you think people with kidney disease should have their vitamin D levels sitting around? And then let's talk about supplementation, if you think that's something that's valuable for chronic kidney disease patients.
Yeah. So the difficult thing with vitamin D is that there's no agreed upon, optimum vitamin D level. And a lot of the research that, say, doctors will often base their levels on, or certainly pathology companies will also base what data say is deficient or insufficient with vitamin D, is based on the research about osteoporosis.
Yeah.
So the research on osteoporosis shows that, potentially lower vitamin D levels are, protective, and that's sort of where those recommendations come in. Whereas I think for a lot of other processes in the body and a lot of other diseases, we actually need slightly higher vitamin D levels than what, a doctor may recommend, or what you may see on your pathology tests again. I guess it is one of, like everything, it's individual as to where someone's vitamin D levels should sit, particularly because we need to look at things like calcium and phosphorus at the same time. But most of the research sort of agrees that definitely needs to be, now when I talk about optimum levels, depending on where you live, will depend on the, what do you call it? The reference range and what it's being, counted. So, say in Australia, we look at vitamin D as in nanomoles, and then in the US, it gets looked at in nanograms. So the numbers are quite different. So just to avoid any confusion. But I guess, most agreed upon level is it certainly needs to be above 75 nanomoles, which is about 30 nanograms. And really, I think for it to have its best effect in the body, we want it to be above, that sort of 100 nanomoles. And which I think 100 is around, it's about 60 nanograms, maybe.
Range is what, 30?
45, maybe. So again, that's something that sort of is still being researched and looked into. So, if I had someone who had, say, elevated phosphorus and, maybe their calcium was a little bit out, I might be a bit more conservative in how high I want their vitamin D to be. But certainly, generally speaking, above that sort of 100 mark. Most of the research shows, and again, it's not looking at its effect on things like calcium and phosphorus, but that, toxic levels of vitamin, you don't sort of get into vitamin D toxicity until, you're in this sort of couple of hundred nanomole and higher. So, there is sort of a bit of a range there, but remembering that vitamin D is a fat-soluble vitamin. So unlike, say, something, if you're taking vitamin C or some B vitamins, if we, are taking sort of more than we need, then we will just excrete it. With vitamin D, we won't. We'll store it in our body, and that's why it can potentially become toxic, because, we're not getting rid of the excess.
Yeah. And I know, look, in autoimmune diseases, there's something called the Coimbra protocol. I don't know if you've come across that yet, where they use zero dosing of vitamin D. So they're using anywhere from 50,000 to 250,000 IU per day. And they have amazing results with treating people like and I know about it because they use it mostly in things like MS or ulcerative colitis. They use it in Parkinson's, motor neuron, but most of them are MS patients because of the research. And there's been some amazing papers coming out. And if you follow the Coimbra pages, people are, their disease becomes completely stable and those sort of things. And so I am on a Coimbra type protocol, and my vitamin D levels sit over 700. So I'm in what you would call toxic range. And what we have to do is exactly as you're saying, my parathyroid and my calcium excretion and everything gets checked, and they don't look at the vitamin D. They look at that, and that's what tells them whether you've taken too much. And so as long as your creatinine clearance and things like that, so as long as all your kidney function and your parathyroid's not being knocked out, you can actually tell how well the vitamin D has been absorbed, everything that Emily said, which is why we have to do all these other tests. Those other tests give you all that information, and that's how we check all of that stuff, by running those other tests. So I have lots of patients sitting in what their doctors freak out about as toxic vitamin D. As long as you're checking everything else and their kidney function is good, then they have no issues. So yeah, it's fascinating. And I know with Australian lifeguards, they measured them, and it was naturally through the summer. They get in excess of 800 nanomoles during summer with no toxicity. So I do think you can push it pretty high. That being said, if you decide you want to do something like that and you've got a kidney-related autoimmune disease like IgA nephropathy and you want to try vitamin D, please work with a qualified Coimbra practitioner. You have to know what you're looking at there. So I digress, but I just wanted to go over that there are some treatments that use these massive hero dosings of vitamin D with very, very, very good effects. So, vitamin D is so powerful and really quite therapeutic, especially in these quite serious autoimmune diseases. So, yeah, sorry, Em, I totally digressed there. So what did you want to talk? I think we should, so dosing, right? So we know what blood levels. So if someone comes and they have their test, their vitamin D is a bit low, let's say they're sitting around 15, have switched between, in the US, we've in the US reference range, they're sitting at 15, which I see people in Australia sitting at, which is so low. What sort of dosaging and, looking at their calcium, kidney function, they've got maybe stage 3 or 4, maybe their calcium phosphorus is okay, but maybe, slightly bumped around, the higher end or something like that. What sort of dosing are you thinking that you would suggest to someone with chronic kidney disease?
Depends a little bit on how often they would be getting their vitamin D levels checked. And I guess, and part of that is sometimes how willing someone's doctors are to continue to monitor that, because I wouldn't want someone to be on a very high dose if we're not going to have another vitamin D test done for months, because that's not very, obviously you can't monitor what's going on. So I guess typically I would recommend around, the sort of 5,000-ish IUs a day, because I feel like that's generally a dose that will increase someone's vitamin D levels, but also a dose that's not going to increase them hugely in a short period of time. And as well, it does depend a little bit on, is someone getting any sort of other sources of vitamin D? Is it someone who does have dark skin, who really I don't think is getting much or any from the sunlight? And also what season it is. So I'll sometimes treat dose differently in winter as opposed to summer.
Yeah, you do exactly the same. And I guess you're right. And it's interesting, the other thing about vitamin D too, right? You give one person 5,000 IU a day and you check them like 2 months later and they've gone from 15 to 30 really quickly. And then I have other patients where you give them 5,000 IU a day and they may be going out in the sun and they go from, I'm thinking in Australian reference ranges now, they may have gone from 60 to 65 and you think, what is going on here? So it is a very individual thing as well, I find, vitamin D. Do you find the same thing?
Yes, yeah, 100%. You can never predict what's going to happen, which is why you need to test.
Exactly. So what else do we need to say about it? So toxicity, what are the symptoms of vitamin D toxicity if someone's worried that maybe they've taken too much? What would they be looking for?
Yeah, so I guess the symptoms are related more so to the changes in calcium and phosphorus as opposed necessarily to what happens in the body if you have high vitamin D, because, you know, as you said, we can have very high levels of vitamin D without having an issue, but it's when it starts to change other markers that we can start to get symptoms. So, and the tricky thing is that they're generally very non-specific type symptoms as well. So things like fatigue, bone pain, nausea, you know, those sort of really innocuous symptoms that can be related to a lot of other things. You know, the sort of things that people might start to report.
Yeah, I know nausea,
like muscle pain and headaches.
Yeah, nausea is the one that I see, the most common one that will sometimes get missed as vitamin D. So, yeah. Okay. So what else do we need to say about vitamin D? I guess the big takeaways that I'm hearing is definitely test. Don't test vitamin D in isolation away from things like calcium, phosphorus, parathyroid hormone, super important to look at. Just because you're taking 5,000 IU a day doesn't mean your levels are going to go flying up super quickly, and to do other things like making sure you're getting out in the sunshine without slip, slop, slapping. And also I'd say if you do go in the sunshine, make sure you don't have a shower for, it's actually, I think it's 24 hours vitamin D sits on the sun, on the skin, isn't it? And while it gets absorbed.
For a long time.
Yes, I think it's up to 24 hours. So if you go out in the sun, or if you're sunbaking, then you're in the ocean, or using, maybe not the ocean so much, but anything that's a soap, you're actually going to wash the vitamin D that sits out on the top of the skin. And because it's fat soluble and you're using an emulsifier like a soap, you strip the vitamin D from being absorbed. So maybe we're all just a little bit too clean these days. Maybe my vitamin D deficiency.
Stop showering.
Exactly. That's what everyone needs to do. Stop showering. Vitamin D deficiency issue. One of the reasons that vitamin D is deficiency is so high, because people shower every day and use soaps, and it's stopping the absorption. I had read that. Okay. Anything else you want to add about the amazing vitamin D, Em?
One other thing, I guess, to be aware of for people who are in the later stages of kidney disease is that so as I was saying earlier, sort of one of the last steps of the conversion of vitamin D until its active form is what happens in the kidneys. So if someone is, you know, sort of stage 4, stage 5 kidney disease, they have a reduction in the ability, because they have less kidney tissue and make less of this specific enzyme to actually convert vitamin D into its active form. So those people will sometimes be prescribed vitamin D receptor activators, or active forms of vitamin D, basically. So it's bypassing the step that would usually happen in the kidneys. So things like calcitriol is a common one. There's a few different types. And I was looking at some research, because, again, there's no clear decision or protocol about using the vitamin D receptor activators, when to use them, at what stage of kidney disease someone might not need to be using them. But also they're starting to do some research about using them in conjunction with vitamin D. So whereas typically they were given instead of, because it was believed that if it can't be activated in the kidney, it's got no effect on the body. Whereas now actually they're looking at whether it's actually better to give vitamin D supplement and a vitamin D receptor activator at the same time.
And what was the outcome of that research?
That it did. There was some, improvements in giving the vitamin D supplement as well. And again, it was sort of initially thought that the only place that we could, that enzyme sort of lived to activate vitamin D was in the kidneys, but now they're starting to see that it is actually in other cells and tissues of the body. So there is some peripheral conversion of vitamin D into its active form, that it doesn't just happen in the kidneys.
Okay. So what's the big takeaway with people with kidney disease that you want them to understand about vitamin D and its importance or not when it comes to maybe adding it in their repertoire of things that they might be using or looking at?
Yeah, I mean, I think it's really important for everyone with kidney disease to be checking their vitamin D levels. That's something I get all of my clients to do, because we know that having low levels has such, I guess, a widespread effect. So definitely getting them checked along with calcium and phosphate, which are often tested anyway, and parathyroid hormone, and then supplementing if your levels are low. They've done studies in giving vitamin D alongside EPO, erythropoietin, in stimulating agents, which people with the later stages of kidney disease are often given when they're anemic, because their body can't make red blood cells as well, because that part of that EPO is produced in the kidneys. And when they give vitamin D alongside that, it actually reduces the frequency of needing those injections. So, helping with red blood cell function and iron levels and lowering blood pressure, all of these things that we are trying to look at and treat and improve with someone with kidney disease. Vitamin D has all of these actions. So don't forget it, I guess. I think because it's something that you can, buy over the counter, it's been around a long time, that people don't realise its, I guess, its effects and how important it is in the body. It sort of sometimes gets sort of forgotten from people's, supplement regimes.
Yeah, I find the same thing in kidney disease. Awesome. Okay. So for all of our kidney community out there, if you haven't had a vitamin D test lately, Emily and I highly recommend doing that in conjunction with obviously parathyroid, phosphorus, calcium, and then making sure that you work with the physician to bring those levels up if that's something that you need to put into your repertoire. Thanks, Emily. So if you've liked this episode from The Kidney Coach, make sure you hit like and subscribe. If you put any comments down below, I will get back to you. I check that most days. If there's any videos you want Emily and I to make, any topics that you really want to know about when it comes to kidney disease, definitely let us know. We're always after any extra great ideas, because otherwise Emily and I sit and rack our brains about what you guys would like to hear. Thanks again, Emily. I always appreciate your time. And until next time, be well, stay well. And if you need any more information, head over to www.kidneycoach.com. There's lots of great articles on there. And there is one on vitamin D. I'll put the link below. All right. Till next time. Bye.
Bye.